Okay, good morning everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Forgive me for the technical difficulties this morning, but I think we're up and running. We're talking about panic attacks right now. Recently I've talked about depression, anxiety in kids. This is a very stressful time for a lot of people. And it's a unique circumstance that many of us have not been in, given the circumstances surrounding the pandemic. And I'm not making any political statements. I'm just saying that a lot of my doctor friends that I'm talking to are seeing a lot more patients with panic-related symptoms, anxiety-related symptoms, diagnosing more and more people with panic attacks. So I thought it would be prudent to just discuss this, discuss some of the underlying physiology of panic attacks, and maybe some things that you can be aware of, given the circumstances of a lot of people being out of work now and a lot of people staying at home and a lot of people being afraid of getting sick. So we're going to talk about panic attacks. What is a panic attack? Basically, it's a discrete period where it comes on suddenly. Typically, it's unexpected, where an individual will crescendo within a period of 10 minutes and it will go away quickly, having periods of intense fear, intense panic, lots of times associated with trembling or shaking, heart palpitations, chest pain, shortness of breath, nausea. Flushing is hot flushing is the new added symptom in the DSM-5, as well as other symptoms of derealization, fear of dying, fear of being out of control. Those are the symptoms associated with panic attacks. Again, they tend to be unexpected. They come on out of nowhere, so to speak. And if they keep occurring, particularly if they are associated with fearful symptoms and they occur, again within a month's time, now we're looking at something like panic disorder. Just because you have one panic attack doesn't mean that you have panic disorder, but if it becomes an issue, then we start looking at panic disorder, as well as if it's impacting your life where you're afraid to go out because you're afraid that you're going to have a panic attack. So panic attacks are typically treated with serotonergic medications referred to as the SSRIs. They keep theoretically more serotonin between the two brain cells, or between the brain cells in your brain, and they tend to improve density of the hippocampus, the memory area, which opposes the fear center. Now, the interesting thing, as I get the brain model out, the interesting facet, if I can get this separated, is that most anxiety disorders and most depressive disorders have an enlargement of the fear center. That's part of the physiology that I talk about a lot, is that the brain kind of gets stuck in this loop of fight, flight, high cortisol, high adrenaline. The high cortisol and high adrenaline feed back and damage other areas of the brain, like the prefrontal cortex, that's critically involved in modulating fear. An interesting element of the volumetric MRI studies, the structural studies, so to speak, of panic disorder, are such that the fear center actually atrophies. The lateral and basal nuclei of the amygdala, that's the fear center, and the lateral and basal nuclei of the amygdala are involved in sensory perception of what's going on in one's body during a fearful state, seems to atrophy, particularly on the right-hand side. So that's curious. And then the research studies have also shown that the medial prefrontal cortex in this region, as well as the orbitofrontal cortex, particularly in the left hemisphere, atrophy in panic disorder patients. And so it's thought that somehow the atrophy in this region and the orbitofrontal cortex, which are modulating regions for the amygdala, then allows somehow the dysfunctional amygdala physiology to come out and relate to panic disorders. Regional cerebral blood flow and other functional MRI studies have shown increased glucose uptake in the amygdala for panic disorder patients, which raises a question, is that amygdala shrinking because it's overexciting itself to death? That's something that, if you want to go back and watch my glutamate and depression talk, that we're now finding when we see areas of the brain atrophy. We're actually seeing that those parts of the brain may actually be overexciting themselves and then shrinking back, so to speak. So the synaptic density, which is where you have a neuron which has its dendrites out here, the dendrites can become blunted and shrunken in. So potentially that's what's happening in the lateral and basal nuclei of the amygdala. So that's fascinating. How do drugs like the SSRIs work? The current theory is that and I'm not prescribing them, but again, it seems that the current literature is showing that they improve the density of the hippocampus. The hippocampus is your memory area, which shuts off the fear center. So potentially they're helping panic disorder patients by shutting off that deep fear center. Other strategies are being used are cognitive behavioral therapy. There's a lot of evidence that helps panic disorder patients. And other things that you can look at if you're concerned about panic disorder include genetics. So it seems that panic disorder has a high degree of heritability, not completely, but there is a heritability component. And researchers have now found some associations with glutamic acid decarboxylase relating to glutamate metabolism, as well as monoamine oxidase metabolism. The monoamine enzyme basically breaks down serotonin, dopamine, and norepinephrine, which is probably why by putting people on serotonergic medications, perhaps that's one of the factors that helps panic disorder patients. So, other natural strategies, so to speak, I'm not treating you, I'm not telling you to do this, but the orbitofrontal cortex is stimulated by leg and hip activity. So we all know that exercise is good for reducing anxiety. Exercise, particularly involving the legs, walking, running, lifting weights with the legs, may fuel increased activity into that orbitofrontal cortex, may not, but it may be something you want to look at. I talk a lot about skewed breathing in my other talks where people breathe in for 5 seconds, out for 2, in for 5, hold for 2, and then out for 7. Again, I can't say that's a treatment for panic disorder, but anything we can do right now, given that panic attacks seem to be on the rise, anything we can do to decrease that global level of fear, I think is a good thing. There's just this background tension many people are experiencing right now, and things that we can do on a daily basis to reduce those fear levels, I think, are a good thing. So that basically boils down to panic disorder. If you have any questions, you want the research studies I looked at for today's broadcast, let me know. But again, interesting finding that the amygdala is actually atrophied or smaller in panic disorder. And also interesting that the medial orbitofrontal cortex and orbitofrontal cortex by itself in the left hemisphere is also atrophied. So things to pay attention to. If you have any other questions, send them to us at info@gatesbrainhealth.com. And I hope you all have a nice weekend, and we will talk to you soon. And thank you again for listening. Oh, and this is one last thing. This was an article looking at the amygdala and the anterior cingulate. I didn't really go through this, but if you want copies of this article, I'll be happy to send it to you. All right, everyone. Thank you so much, and have a lovely day.